Hey everyone, this is Malki Assad and welcome back to the channel. Today I'm excited to have Dr. Saeed Azoury, who is the Chief Plastic Surgery Resident at the University of Pennsylvania, to talk about what to look for in the residency program. Welcome Dr. Azoury to the channel.
Malki, it's very nice to be with you tonight. As you mentioned, I'm a chief resident now at the University of Pennsylvania, and I took a longer route to plastic surgery. I did general surgery at Hopkins for 7 years with 2 years of research, and I was interested in general reconstructive plastic surgery. And so next year, I'm actually doing a 1-year fellowship at Memorial Sloan Kettering in microsurgery. So it's a pleasure being on with you tonight, and I'm excited about this topic.
So I would like to start by asking you about clinical experience. This is one of the main reasons why residents do the residency, and clinical experience is of paramount importance when you're looking at residency programs. When you're evaluating programs, what are the factors you look for to assess a program clinically?
Yeah, I think that's a very good question and a very important point for applicants, because regardless of what you go into, I think what should be top of your list should be the clinical volume and the mix of cases. I think that those are two very important things together. So not only how many cases is a certain program or institution doing, but what are the mix of cases? For instance, if you're looking for a general surgery residency program, are they doing a good mix of laparoscopic cases, but also open cases? Is there a good mix of vascular cases, but also hepatobiliary cases? If you're doing plastic surgery, is there a good mix of craniofacial, microsurgery, whatever it may be? So I'd say mix is extremely important, but also case volume. And what I mean by that is that to be a good surgeon, you need repetition. You need to not only see the cases, but you have to see the complications, and you have to do cases a number of times. And so talk to the residents and talk to the faculty members. Are you in the operating room almost every day doing multiple cases? Because I think that that's a very important point.
That's awesome. And in the previous years, applicants used to go on away rotations, assess that in person. But especially this year, it's harder with the virtual environment. How can you assess programs through virtual interviews if they have enough clinical volume and diversity of cases?
Yeah, I think, you bring up a good point, and that's the kind of the virtual nature of medicine these days, unfortunately. But the good part is that you can talk to your mentors, talk to people you trust, talk to residents who have done that are currently at the programs and befriend them. A lot of them are probably like me, and I love talking to people about the process that I went through, but also what you can look forward to. And so find somebody in a program, whether it's a resident or a faculty member, and I really recommend both, and talk to the resident and ask him, ask them, what cases are you doing? Can you give me on any specific week? What does your week look like? Or if you're applying for a medicine program, you can ask them, what is your typical week like? How many patients do you have on your service? And things of that nature. And similarly with faculty, you can ask them, what does the week look like? What does the month look like? What does the overall experience look like? And I think really just asking multiple people. And I think the most important point is finding somebody you trust and multiple people, because then you can kind of combine the different answers and opinions of multiple people.
Perfect. And resident autonomy is extremely important both in medical specialties like internal medicine, pediatrics, and surgical specialties. How can you assess resident autonomy, and how important do you think it is for residency programs?
Yeah, that is an excellent point. And I think that resident autonomy, I always say this to people, needs to be taken with a grain of salt, because when you go to a specific program, there is a lot of value to learning from experts in the field, regardless of the medical specialty. So whether it's medicine or surgery or whatever it may be, emergency medicine, don't be fooled by autonomy. That means that basically you're left alone to learn what you need to learn, and you don't have the mentorship or the guidance and the expertise that you need. There's a lot of value to that. So I take it with a grain of salt. I do think some graded autonomy is extremely important, which basically means that with experience, as you feel more comfortable and as you've had the opportunity to learn from these experts in the field, regardless of the specialty, then you start to do procedures or interactions, patient meetings, and things like that on your own. And I think that that's important. But there's a lot of value to learning from these people because that's why we're in residency training. And I think, again, the best way to assess that is really talking to people. I think that finding residents, finding faculty members, and everyone likes um, a resident to be satisfied. And so you want to go to a program that you're happy with. And so you want to be upfront and ask these questions.
Awesome. These were really great points regarding the clinical experience. And now I want to ask you about the people that you'll be working with. During residency, you spend years, long hours in the hospital, both in surgery and medicine. How important do you think are the people that you'll be working with, and how can you assess your fit with the program?
Yeah, you're absolutely right. I think that residencies can last anywhere from a few years to 6, 7, or even 8 or beyond, depending on if you take time off for research and such. So who you're surrounded by is incredibly important. And not only the other residents, but also the fellows and also the faculty members. And I think when we're in this virtual era, medicine era, I think that it all goes back to the reputation of programs and trying your best to get to know the residents and faculty, whatever it may be. For instance, if you do a virtual meet and greet at a certain program or a virtual interview, try to befriend a few of the people who you interact with and talk to them and get a sense for if the atmosphere is an atmosphere of collegiality where people work together and help each other out. And if people really hang out outside of work, I think that's very important. Malki, I think as an aside, even you getting the sense for the family nature of the group. Do they get along? Is it sort of like a family? I have a family myself, and so I never find it hard to ask programs or other people, how is the program for a person who's coming in with family? Do you guys hang out outside of work? And if you do, what do you do on a typical week? Who was at your last wedding? And I think that these are all really important points because it can be a very long road if you're isolated and alone, but the friendship that you acquire can be lifelong.
Yeah, definitely. And as you mentioned, if, for example, you have a family, you want to ask if this program have residents with families or they'd be open to having residents with children. So this is a great point and to ask about when you're interviewing with programs.
Exactly.
So now another point that is important for some applicants is research. Programs differ in their focus on research, the type of research they do. Can you please tell us a little bit about the research experience and how applicants can assess that when they're interviewing with different programs?
Yeah, I think that you have to ask yourself, first off, how interested in research are you? But don't give up too early because admittedly, even myself, when I didn't know much about research, I wasn't so excited about it. And the more I learned, the more in love I fell with it. So I would just say that give it an opportunity and look for what programs have sort of produced in the past. And if you are very interested in research, the next question you have to ask yourself is, do you want the opportunity to take time off in residency? And I know that some certain programs, regardless of what specialty it is, may offer you the opportunity to get an additional degree, an advanced degree, whether it be a business administration or a master's in public health, a PhD. That's always an opportunity in certain programs. And for instance, as a general surgery resident at Hopkins, that was almost pretty standard that residents would take the time off and pursue an additional degree. I think the other question you should ask yourself is your interest in basic science or clinical research, and one more than the other, or both potentially? There are certainly, as you know, some programs that are very heavy and very strong in clinical research, but potentially not as strong or potentially don't even do any basic science research. And so if your goal is to be a basic scientist or a surgeon scientist in the future, that's very important to know going into your training program, because you will likely want to take some time off and you also want to be supported. That brings up another point is is again, this all goes back to talking to people in the programs and asking them, what sort of support did you get to pursue your research ideas or your advanced degrees? Did you get financial support? Were they willing to let you take 1, 2, 3, 4, however many years off that you wanted? And questions like that.
Awesome. I know that you've been extremely productive during your residency and you published several papers clinically mainly. Do you think it's how easy it is to publish during residency, and is it reasonable to publish basic science research without taking time off?
You should probably answer this question because you're extremely productive. So I should be learning from you. But it's it is it's easy to be productive if honestly it goes back to you enjoying it. If you enjoy it, you can be productive. And I always used to look at my mentors. I had a mentor in general surgery who always used to say that if you really love what you do, you're not working any day in your life. And I always think about Rod Rourke, as you know, who really advertises that if you love what you do, you're not really working. And I think that if you, as I mentioned to you, I didn't have a strong interest in research when I didn't know about it. But the more I knew about it, the more interested, and now I really consider it a hobby. And so it all goes back to your interest. And I think if you're very interested in it, you can be productive. I think one of the most important points, which I'm sure, knowing the person you are, I'm sure you're well aware of this, but team building is the key to successful research, particularly when you're a busy resident. So you want to befriend other residents who have cool research ideas, medical students. There are so many bright medical students out there interested in doing research, and find faculty members. This all goes back to mentorship, who are willing to support your research ideas. It's totally possible. You just need a team and you need the support.
That's 100% true. Now I want to ask you about the fellowship. Many applicants, when they go into residency, they have specific interest in particular fellowships, both in internal medicine, in surgery, plastic surgery. What should they ask about when they interview with programs, given that some programs are more likely to get you into certain fellowships than others?
Yeah. I think the track record is always important, but again, I think that that's very important, but also take it with a grain of salt. I think a lot of what you put in, you can get out. And so you may want to go to a certain program or a certain institution because it's closer to home. But if you're hardworking and you have a goal in mind, and if you want to do a certain fellowship, you can make it happen. That being said, I think there's a lot to be said about a good track record. So checking the program, and a lot of program websites have the past trajectories of their alumni. And that's something that I did very commonly when I was applying to programs, is seeing where did the residents go? What fellowships did they pursue? Was it a nice variety of fellowships, meaning both geographically, in terms of what the type of fellowship is, and was it their top choices? I think that those 3 points are important. And regardless of what you do, I think that you should look at the track record to see, because if you notice that certain programs are only putting certain residents into certain fellowship positions, then you may ask yourself, I want to go to more of a program that, in case I change my mind and I develop a new interest, I don't want any closed doors. So I think looking at the track record, looking at the websites, maybe checking the alumni of those programs is very important, and also talking to people.
Perfect. And how do you think the size of the program, how many residents they have, can play a role into people choosing certain programs over others?
This is one of my favorite questions, and it's because it's a question that I think is underemphasized, and you really have to ask yourself 2 points. Number one, do you want a big program? Or number two, do you want a smaller program? And there is probably some benefits to both. The nice thing about a smaller program, which is one of the reasons why I chose the training program where I am, is it is a larger program, but it's probably on the middle size of residency programs, is that I didn't want to get lost in the mix. And so I still wanted to have the one-on-one attending interactions, the close-knit residency group. I wanted to know all of the residents. I wanted all of the attendings to know me. And I think that that's very important, particularly when you start to talk about things like friendship and mentorship. Now, so those are the huge perks about medium to smaller size program, is that most people know each other, and I think that that's priceless. When you talk about much larger programs, the benefits of that would be you have obviously more people to interact with, and you have more friends to make. But my only thing that I would caution applicants to is you want to ask yourself, is the program potentially too big where I would get lost in the shuffle? And or do I want a bigger program where I can meet new people almost monthly and make potentially more friends and things like that? I think that those are two very good points.
Awesome. And another important point when selecting program is the location. Cities vary in their size, in the weather. Any thoughts about how important is the location of the program in selecting the program when interviewing and ranking?
Yeah, when you there are several uh, key aspects to this question, and I think one of the things you have to think about is where you're from and if you want to potentially settle in that area. A lot of people say that a program that you choose, you develop mentors within that program, and they may have connections within that geographical region, and that may ultimately help you land a job in that geographical area. So, for instance, if you want to settle in the Northeast, it may be worthwhile to go to a residency program in the Northeast where you can get to not only know the people or the big names from those areas, but also go to the Northeast regional conferences and mingle with those same people. The second question is, do you want to be close to home, close to family, to have that family support? That's something that I thought about in medical school. I wanted to go to medical school close to home because I wanted to see my parents, I wanted to see my family, and I wanted to have that extra family support. And I think that there's a lot of value to that. I think that choosing a program potentially close to home, if that's the type of person you are, there's a lot of value to that. And we're lucky to have so many great programs in this country, that may be a possibility for a lot of people. And then, of course, the point that you mentioned, is the type of city. And you want a livable city, and you want it to be, you want the cost of living to be reasonable. And I personally want safety. And for me, it's for my kids, but it's also for me. I walk to the hospital 10 minutes away from where I live, and I have not had any doubt, like there's no doubt that it's going to be a safe walk. And I take my kids on the same walk that I walk to the hospital, and there are plenty of restaurants around. Commuting is easy. The cost of living is great. Those are all really big points. So,
These are really great points. And so you think that the choice of a city goes beyond your residency time to the prospect of jobs afterwards through building connections during your residency time?
I think so. And I think that the other way that you can potentially be strategic about it is, like, for instance, if you have done medical school, for instance, on the West Coast, but you want to try something new and you're not sure of where geographically you want to settle, then it might be worthwhile to pursue residency on the East Coast, for instance, in a different geographical area. And that way you can have people who you grew to know and connections from, the West Coast where you did medical school, and then a whole new group of connections from your residency program. But I do think that there's a little bit of value to thinking about it's always about thinking ahead, as I'm sure you know. What's your next step in life? And I think that it makes a lot of sense to establish connections, at least in a larger geographical area, of where you could potentially see yourself in the future.
Perfect. And any thoughts regarding the educational materials of the program, the didactics, the conferences they have?
Yes. I think that's very important for many reasons. I think that you definitely want to have protected education time. and you want it to really be protected. So this all goes back to talking with the residents and even faculty members. And uh, for instance, is it just one day in the morning that's dedicated to education conference, or are there afternoon conferences sprinkled throughout? Do they have journal clubs, weekly, or however often do they have the journal clubs? But whatever it may be, making sure that it's protected and that you will be able to attend to it, and that you're not supposed to be doing some other clinical activity that may interfere with it. So I think that's important. And then the second part to that, I think that's important, is support to attend educational conferences, not only within your institution, but elsewhere. So if there's, for instance, this is pertaining to plastic surgery, but this could go for any specialty. If there's a maxillofacial trauma course that you need to go to learn certain principles, will you be supported by your department to go there? If there's a hand surgery course, could you potentially go there, or another cadaver flap course? I think that looking at what they've done in the past, what the program's done in the past in terms of support for those educational activities, not only in terms of emotional and physical support, but also potentially financial support. So it all goes back to protected education time and support.
Awesome. And how important do you think is the mentorship in the program and the leadership of the program in making you advance through your career?
Yeah, that's priceless, and it's something that I've really grown to appreciate as time goes on. And I think that that is probably the most important point, in my opinion. And the reason for that is you can have a small program, large program, whatever geographic location, but if you have good mentorship, it will make a residency experience truly incredible. And one thing that I like to tell people, which I kind of underappreciated before I was applying to, general surgery residency and then now plastic surgery, is looking at the program director and looking at the leadership of the program. So the chair or the chief, and what kind of people are those people? Are they nice people? Are they easy to get along with? Can you email them when you need to email them with a concern? Do they support you from research, academic, future career? Those are all really important points. In my personal opinion, you want those two specific individuals to be approachable when you're talking about the chief chair and the program director. You want them to be approachable, and you want them to be known for good mentorship. And then secondly, the same goes to the rest of the faculty. If you're in a program that has 4 or 5 faculty members, perfectly okay, as long as you can find good mentorship within that group. If you're in a program with 30 faculty members, but have no history of being good mentors, then it defeats the purpose of going to a much larger program. So definitely looking at the leadership, making sure that they have the amiable, approachable mentorship qualities that you want, and also looking at other faculty members to look at their track record potentially.
These were extremely important points. Dr. Azoury, do you have any final thoughts regarding what to look for in a program when interviewing and ranking?
Thank you, Malky. This has been really great. I think that we covered all the major important points. But one thing that I do also like to tell people is that it's good to feel wanted. It's good to go to a program that you feel that they want you and that you want to be there. Because it means a lot. It means that if you get the sense that you have friends there, or you've heard from the faculty members, and they see a lot of potential in you, these are early signs that they will be good mentors to you. I truly believe that, and I think that that's another very important point that should be emphasized, is looking for a program that you think not only that you want to go to, but also they want you. That's very important. So otherwise, I think you really nailed it all, and best of luck to all the future applicants out there.
Thank you so much, Dr. Azoury. That was extremely insightful discussion. For our viewers, if you have any questions, you can leave them in the comments below. Subscribe to the channel, hit the like button if you like the video, and thank you so much for watching.